Well, good morning. This morning I am at the Pennsylvania Chamber of Business and Industry, and believe it or not, right behind me, those leaves are blocking the Pennsylvania State Capitol. The great big dome is back there somewhere. So if I come back in about 3 months, I suspect, Carrie, we'll actually be able to see the Capitol. But I'm with Carrie Lutz from PCI. They're housed here at the Pennsylvania Chamber of Business and Industry. My first question for you, Carrie, is you're Carrie Lutz, PCI. Tell us who you are. Tell us who PCI is.
Certainly. I'm Carrie Lutz, as Bob said. Thank you, Bob, for the introduction. I am a certified Medicare agent and individual coverage specialist with the PA Chamber Insurance, which is the insurance subsidiary of the State Chamber of Business and Industry. We are created to service the members of both the local chambers that partner with us and our local businesses and statewide businesses to provide insurance benefits, benefits design and counseling, human resource points and details, and also insurance information and the ability to have a broker to guide you through the process of shopping, carriers, all kinds of different plan designs.
So it sounds like all things HR, pretty much, or most things HR, as well as you're our secret shopper when it comes to healthcare insurance and healthcare, getting connected with those different providers. Well, it's beginning of October, and October is a critical month in the Medicare industry as well as the whole healthcare area. Can you tell us what are the most important dates this month for our chamber members, both large members and small members, when it comes to healthcare insurance? And then also tell us a little bit about the Medicare side as compared to the non-Medicare side of the health insurance industry.
Wonderful, thank you. So as Bob stated, October and coming into this time of year is a very important time in the insurance world, both for Medicare enrollees and individual coverage insurance. We have October 15th as the start of the enrollment period for open enrollment on Medicare, which means that anyone that has a current Medicare plan that they'd like to change, or if they would like to newly sign up for Medicare if they missed their initial enrollment at turning 65, this is the time of year to take advantage of the shopping and signing up for a plan to be effective for January 1 of the following year. So it's called the open enrollment period for Medicare, and it allows Medicare enrollees to change the current plan that they're on or to shop for a new plan if they've never signed up for Medicare before. After the October month is over, there's also open enrollment for individual coverage insurance on the marketplace. That is the time of year that it becomes an opportunity for those without coverages to look at plans through the Pennsylvania marketplace and sign up for a plan. You can sign up starting November 1st. It goes through the end of January. The plans can start on January 1 at the beginning of the year or February 1, depending on when the applications are submitted. I'm certified both with the Pennsylvania marketplace and also several other carriers in the state. So there are lots of coverage choices that we can make available to you if you reach out. And I'll be able to give you my contact information at the end of the call.
Well, and we'll get to that because that's the all-important contact information. But before we do that, I do want to ask sort of alphabet soup when it comes to Medicare, when it comes to healthcare in general. Can you walk us through the alphabet soup? Give us the high level, what's Part A, Part B, Part D, et cetera.
Absolutely.
Yep, thank you.
So before I get started, I just wanted to point out that the state makes available an absolutely incredible resource, and it's for the federal Medicare program, Medicare and You 2024 Guidebook, available on their website at medicare.gov. And it does give you a nice walkthrough of information in regards to the process and the steps, gives you the layout of the vocabulary. So I'm going to give, as Bob said, a pretty high level detail of the alphabets involved in the Medicare plans. The first alphabet piece that comes into play is when we discuss Part A of Medicare insurance. Part A is anything that covers your hospital and inpatient care, skilled nursing, hospice care, and home health care. Part A of Medicare is the piece that you earn by working and paying through your Social Security and Medicare benefits through payroll. You are required to have a 10-year work history with at least 4 quarters of that work. But we can talk about all those details. I don't want to get too much into the weeds on Part A, but most people do not have to pay a premium for their Part A insurance. That is the earned piece. The next piece that comes into play when we discuss Medicare is Part B, which is the coverage for your medical insurance. Part B is the piece of Medicare that will eventually, if you work and retire, it will replace the coverages that you would have through an employee plan. For example, it helps to cover the services from your doctors when you visit your specialist, when you visit your family doctor. It covers your medical equipment if you have concerns where your doctor needs in-home equipment. The Medicare Part B covers that piece. It also covers most of the preventive screenings and medical interventions that would be necessary on like an immunization basis, your yearly physical, any of the diagnostic screenings that get performed on an annual basis or a biannual basis. Those are covered under the Part B insurance. Now with Part B, that is an optional piece with Medicare. So that is not something that you have to sign up for when you turn 65. It becomes an option to you that could be a replacement for your current coverage, or it could transition to your only medical coverage. The Part B premium, which you would pay monthly for the insurance, much the way you pay a monthly premium for a current plan, is set by the federal government each year. For 2023, it's $164.90. That was actually $7 less than it was for 2022. They haven't yet released the rates
We like that,
for 2024.
yeah.
We really do like that. So the information on that does change, but it maintains an affordability which is key to the Medicare programs. There are several options that make great coverage affordable once you have the ability to look at your Medicare options, either at age 65 or if you become eligible through 24 months of disability will also give you an automatic enrollment period for Medicare, which is an interesting point.
Right.
There are some extenuating circumstances where Medicare does become available before the age of 65. And I'd be happy to talk to anybody to whom that applies as well.
Well, and let's get to the all-important contact information. But before we do that, let me give a personal endorsement. Actually, I had one of those birthdays, turned 65 this year, and I soon after that I met with Carrie. Probably should have met with you soon before that, but it was soon after that we met, and we met in a coffee shop. It was a very, very pleasant experience. And what I really loved about it is I was given a menu of choices to pick from, the things that made most sense for me. And yes, I was able to keep my own doctor. So I was thrilled by that because Carrie was able to take the prescriptions that I have, the doctors I use, and plug those in so I could stay with familiar faces and the folks that have kept me healthy all these years. So we're going to wrap up by, Carrie, tell us your contact information. And one more time, tell our members what is it that they need to do today and what can they wait another week or two to get done. But first contact, and then what do I have to get done today?
Sure. My name is Carrie Lutz. My email address, which is a great way to reach me here at the PA Chamber, is clutz, L-U-T-Z, at pachamber.org. You can also contact the Greater Susquehanna Valley Chamber. They have my contact information, and I'd be happy to send information along if you contact me. My phone number also, if you'd like to reach out that way, is 717-577-8521. As far as things to do on a timeline basis, any time is a good time to ask questions. So if you have any questions, if you know that you have an upcoming enrollment concern, or you might be eligible for Medicare benefits, or you're looking to change your options for individual coverage or just explore them, feel free to reach out. Insurance is often a topic that people feel uncomfortable discussing and opening it up. But once a few questions are asked, it really becomes very easy, and it doesn't take very long to get to the point where we can actually discuss plans.
Well, thank you, Carrie. And one more time, that's Carrie Lutz at the PA Chamber. You can contact her directly or come through the Chamber. The PCI, or the Pennsylvania Chamber Insurance, is an affinity program that you have access to as a Chamber member, and we encourage you to do that because working together and taking care of all of our healthcare needs, we know for sure that our best days lie just ahead.